What is the best way to take a child's temperature? Knowing how to accurately check a child's temperature is a helpful skill for managing their health at home. The best method depends on your child's age and cooperation level. For infants under 3 months old, the most reliable way is to use a digital rectal thermometer. This method measures the core body temperature, which is very important because even a slight fever can indicate a serious infection in a young baby. To do this safely, clean the thermometer first, put a small amount of lubricant on the tip, gently insert it about 1/2 inch to 1 inch into the baby's rectum, and hold it in place until it beeps. Always stay with your baby during this process to ensure safety. For children between 3 months and about 4 or 5 years old, you can use a rectal thermometer, but other options are also available. Forehead thermometers that measure the temporal artery are quick and less invasive, and ear thermometers that measure the temperature inside the ear can be accurate if used correctly. If you choose an underarm or axillary thermometer, place the tip in the child's armpit, make sure it touches the skin, and hold their arm against their body until the thermometer beeps. Keep in mind that underarm readings tend to be less precise and might underestimate a fever. When your child is 4 years or older, oral temperature measurement becomes practical. Have your child keep their mouth closed around the thermometer, place it under the tongue toward the back, and wait for the beep. Make sure they haven't eaten or drunk anything for at least 15 to 30 minutes before taking the temperature, as this can affect the reading. Always follow the manufacturer's instructions for any thermometer you use to ensure accuracy. Some parents find forehead or ear thermometers very convenient because they are quick and less invasive. However, their accuracy can vary depending on the device and how well you follow the instructions. Digital pacifier thermometers are also available for infants but are generally less reliable and mainly useful for screening rather than precise measurements. No matter which method you choose, always clean the thermometer before and after use to prevent germs from spreading. Stay with your child during the process, especially if you're using rectal or oral methods, to keep them safe. If you're unsure about the reading, or if your child is very young, very sick, or showing other concerning symptoms, contact a healthcare professional for advice. Remember, getting an accurate temperature helps you decide if your child needs medical attention. Fever is common in childhood illnesses, and knowing how to measure it correctly is an important tool for parents and caregivers. Trust your instincts and seek medical help if you're worried about your child's health.